Good morning, everyone. Welcome to the complex exam. My name is Virág Róna, and my PhD topic is the polymers in dentistry. I am a third-year resident at the Department of Prosthodontics, but right now I'm at maternal leave, and my supervisor is Zoltán Géci, and my scientific methodology supervisor is Kata Kelemen. My mission is to research the usage of polymers in dentistry, mainly focusing on chitosan, and my vision is to find some new alternatives that can be used in clinical dentistry. I have two specific goals. The first one started in 2022 September, and the second one in 2022 November. So the first project is the effect of chitosan on the number of streptococcus mutans in saliva. It is a systematic review and a meta-analysis. And this article has already been published in 2023 October. And soon after the publication, my daughter Aurora was born in December, and since then she became my little study buddy and partner in crime. So back to the background. Streptococcus mutans is a facultatively anaerobic gram-positive coccus which can be commonly found in the human oral cavity. And this bacteria has a very important role in the development of dental caries by forming an EPS-rich and low pH milieu. And according to WHO, it is estimated that almost 2 billion people suffer from caries every day. So polycationic polymers are antimicrobial polymers which has growth inhibiting and destructive properties. These polymers have two main functional groups. One of it is a cationic group and the other one is a hydrophilic group. And with the help of the cationic group, they can form some pores on the cell membranes, and by this they can increase the cell membrane permeability and they kill the cells. So our aim is to investigate the efficacy of polycationic polymers on the number of streptococcus mutans in saliva. Here you can see the clinical question that we used and the PICO, and our hypothesis was that chitosan reduces the number of bacteria. We conducted the systematic search based on this search key, and all in all we got 6,758 articles. And after all of the selections, we got all in all 4 full eligible texts. And out of these 4, 3 were in the meta-analysis part and 3 plus 1 were in the systematic review part. So here you can see the main results of the meta-analysis. So we had 3 studies. Our outcome was the number of streptococcus mutans measured in CFU per milliliter, and it is a highly important outcome as this bacteria is mainly responsible for the development of caries. And as you can see, if you check the baseline values, you can see a quite high heterogeneity. And the reason for this could be that in every single individual person, the oral bacterial flora is different, as this flora is influenced by several factors throughout life. And if we check this forest plot, we can say that however the results were not mathematically significant, we can see some reducement with the chitosan group. So in the chitosan group, they use the chitosan containing chewing gum, and in the control group, they use the placebo chewing gum. Maybe here you can understand it a little better. On the right side, there is the the controls, and the So in the left side, the controls, in the right side, the interventions, and on the top, you see the baseline values. On the bottom, you see the values after the change. And we can say that in the control group, where they used the placebo chewing gum, there were 24% reducement, and in the intervention group, where they used the chitosan chewing gum, there were an 83% reducement of bacteria. So the strength of this analysis is that all of the articles were randomized controlled trials, and this is the first meta-analysis in the topic, and we used the pre-registered protocol that we followed. But we have some limitations that we had to impute the standard deviation and the correlation of the changes, and only 3 studies were unfortunately included in this study. Actually, 3 studies were available at that time. So based on our analysis, we can say that chitosan has some antibacterial properties, and it can reduce the number of streptococcus mutans as an ingredient in chewing gum, but of course further research is very much required to obtain more significant results in the future. So as a summary, we can say that chitosan could be used as a primary prevention tool for caries, and the implication for research is that more clinical and in vitro studies would be needed to have more reliable results. And our manuscript was published in the International Journal of Molecular Sciences. It is a D1 journal with the impact factor of 5.6. So the second project is the effect of chitosan on the number of Enterococcus faecalis. It is also a systematic review and a meta-analysis, and I'm planning to submit this article in this summer, August. So Enterococcus faecalis is a gram-positive bacteria which is capable of growing in both anaerobic and aerobic environments. And commonly this bacteria is detected in asymptomatic and persistent endodontic lesions. One thing that I have to mention is that nowadays the gold standard irrigation material in endodontics is the sodium hypochlorite. And our main question is that could chitosan be a new alternative for this material? So our aim was to investigate the efficacy of chitosan on the number of Enterococcus faecalis. Here you can see the clinical question and the PICO that we used. We had two outcomes. Both of them were the number of bacteria, but the first one were in CFU per milliliter, and the other one was the inhibition rates. And our hypothesis was that chitosan reduces the number of bacteria. We conducted the systematic search based on this search key, and all in all we got 889 articles. And after all of the selections, we got 10 full eligible texts, and out of these 10 texts, 6 were in the CFU per milliliter forest plot, and actually other 6 were in the inhibition rate forest plot, so there were a little bit of, okay, so you can, because we have a little time, I am just showing you one outcome, the inhibition rate outcome, and I think this outcome were a little bit more interesting. So we used two subgroups. In the first subgroup, they used low concentrations of chitosan and sodium hypochlorite, and in the second subgroup, they used higher concentrations of sodium hypochlorite and chitosan. And as you know, as we increase the concentration of sodium hypochlorite, it can have several side effects, like it can cause chemical burning in the mouth, or it can cause necrosis in the mouth. So we have to be very careful. But as you can see on this forest plot, as the concentrations were increased, chitosan seems to be working as good as sodium hypochlorite, or even in one case, even better than sodium hypochlorite. So the strength of this analysis is that a pre-registered protocol was followed, and this is a novelty in the literature, as there is no meta-analysis in this topic before. And the limitation is that the study methods were unfortunately not consistent in all of the articles. So, as a conclusion, we can say that there is a tendency that chitosan would be a great alternative to sodium hypochlorite as an effective irrigation material or agent, but we would need more studies in the future to have more significant evidence. And the implication for practice is, as I mentioned before, chitosan can be used as a root canal irrigation material, and the implication for research, actually in our article, we suggested a measurement design for the future investigations, because we think that it would be great if all of the future studies would be conducted with the same standardized measurement design, because this is how we could have actual results, because when they use like several fields for the bacteria and other things, then we can say that it's really significant. So our manuscript status is that I sent it to the internal review. Actually, it came back since then. So in June of the 12th of June, it came back. And now I will send it to the language editing. And after the language editing, we will submit it to the International Endodontic Journal. The impact factor is 5, and it's also a D1 journal. And I would like to thank you for your attention with a quote from Jane Austen: "It isn't what we say or think that defines us, but what we do." Thank you so much.
Thank you. It seems that your study buddy is very effective. You are progressing quite well.
Thank you.
So congratulations. I'm wondering if...
Thank you for your presentation, Virág. I would like to ask you if you know about how they produce chitosan, as you mentioned that it's not too easy to give a right concentration from it. How do they produce it to the right concentration?
So actually, chitosan is a natural ingredient because it is from chitin, and chitin is like the natural structure of insects, and they use alkylic deacetylation for the producement of chitosan. So yes, but actually chitosan is a little bit cheaper than sodium hypochlorite. So maybe in the future, if we would have more reliable results and significance level, then maybe not just for the patient side and for the side effect side would it be great to use it, but also for the finances.
So you would recommend it?
With more results, yes.
Okay, thank you very much.
Congratulations to your presentation. My question is about your first project, and it's about how long did the patients use the chewing gum? Is it like once for a week, or once per day for a week, or more or less?
No, they use like several, so the study investigation was like the patients came in the morning, they had to have breakfast, and after breakfast they wash their teeth. And after washing the teeth, first they have to chew the placebo, not the placebo chewing one, but for the baseline value for wax, just simple wax. They chewed wax. And after this, so they randomized the patients, and some of the patients got the placebo chewing gum, some of the patients got the chitosan-containing chewing gums, and they have to chew it like several times a day. Like they chewed it once, and 1 hour later, one more, and if I remember well, it was like 4 or 5 times in the whole afternoon that they chewed the gum.
So they measured it only in one day? Okay, thank you.
Do you know any other clinical usage of that chitosan?
Yes, in other medical fields. They, for example, used it in the army for wound healing. And they can use it not just in medical fields, but in agriculture. They can use it for, yes, this.
Yes,
This is what I can remember.
Actually, several papers appeared about hemostatic agent as after extractions as an alternative of fibrin sponges or collagen sponges, and it's effective reducing bleeding time and so on. But I was not. So that's a new information that such an antibacterial effect it has also.
Yeah, and we are planning in the future to also research it for periodontal diseases, like the bacterial flora of periodontal diseases.
So, congratulations for your progress. My question is that would chitosan would be used as a substitute for sodium hypochlorite or in conjugation with it, like sodium hypochlorite dissolve also the organic tissue. So does chitosan has such property?
In my opinion, if in the future we will have more statistically reliable results, of course it's the question of years, I think. But I would maybe I would use it as so I would leave sodium hypochlorite and use chitosan in the place of sodium hypochlorite.
Thank you.
So congratulations for the nice presentation. And do
you.
we know something about the mechanism, how it can reduce the number of bacteria, and does it affect the gram-positive bacteria? You investigated 2 gram-positive types, so do we know something about that?
Can you please repeat the beginning of the question? Sorry.
So the mechanism, how it can reduce the number of bacteria,
Yes.
do we know something about that?
Yes, of course. So chitosan, as I mentioned in the first part of the presentation, chitosan is a polycationic polymer, and these polymers have two main functional groups. And one of it is a hydrophilic, the other one is a cationic group. And with the help of the cationic group, they can attach to the cells, and they can form some pores on the cell membranes, and by this, after the cell membrane permeability is increased, then the cells will decrease or drop. And it can cause not apoptosis, but the death of the cells, yes.
So the second part was that does
Yeah.
it affect the gram-positive
Yes,
bacteria?
yes.
And regarding the gram-negatives or anaerobes?
Actually, as I just studied now streptococcus mutans and enterococcus fuocalis, I can say that for these two bacteria it is effective, but I think that in the future we can have more researches, but I think, yeah, it will be effective on both.
I might have missed your explanation, but in the first study, you had these three papers.
Yes.
Two of them is from one group, and the other one from the third one.
No. Yes, it can be confusing, as two of the articles were from the same author and the same university. Just one moment. Oh, here it is. Yes, but there were 1 year gap from that, and we wrote to the authors if the population were the same or it was not the same. And they told us, I don't know if it's true or not, but they told us that it were not the same population, so we used it as a different population in two topics. But it could be, of course, it could be a bias.
Mm-hmm. Yeah, that's because you have this only, the third paper is the one which is radically different from the previous two. Why is that? So how would you explain that they see a much larger change than no change practically?
Yeah, the explanation for it could be that in the first two cases, in Hayashi, they used the chitosan containing chewing gum for more time. And in the case of Camverdi, they used it for just a small amount of time. So actually, we could conclude that when chitosan is used in a small time gap, it's maybe not that efficient. But when we use it like a little more time, it's not that wide of a difference. But if we use it like for more hours chewing the gum, it could be more efficient. So, of course, it is not sure that chewing gum would be the best solution for using chitosan as a prevention tool. So maybe it would be like oral mouthwash or something. I don't know. It would be great to have more researches in the future. But now we have these kind of researches, and we have to use this for conclusions.
Yeah, thank you. Over there, please.
I would like to congratulate for this great presentation, and my questions are mostly practical questions. First of all, according to your second project, did they publish the concentration of the sodium hypochlorite in the different groups? Because you mentioned that there was a subgroup where the concentration is less than 1%, as I see. But I don't know, it's just for the chitosan or for...
Yeah, they published the concentrations, but not in all groups were the same. So in the second group, where they used the higher concentrations, it was around 5% for the sodium hypochlorite. And when they used the lower concentrations of sodium hypochlorite, it was around 2%. So, and yes, in the first case, chitosan was below 1%, and on the second, chitosan was more than 1%. So, the main thing that we used for comparison, and they used for comparison, is that they always used lower percentages together and higher percentages together in the studies.
Okay, thank you. And did they mention any activation methods? Or they just used
there
the
were
irrigation?
no extra activation method. I know that they can use ultrasound and some kind of activation methods, but in these studies there were no activation method, just the irrigation solutions.
Okay, thank you.
Congratulations for your presentations, and I would like to follow Dr. Komara's steps with the questions regarding the second project about the inhibition rate. How long did they apply these solutions to the bacteria, and how often did they refresh the solution, if they did?
Well, if I remember well, the solution was left in, actually it was these were in vitro studies. And the solutions were left in the root canals, I think, for 20 or 30 minutes, all in all.
Okay, so they did not refresh it. And my second question regarding this one, do you know anything about the penetration depths into the dentular tubules of the chitosan?
Well, actually, I'm sorry, I don't know anything about it, but it's a great question, and maybe in the future we will study also it, so the penetration depths.
Okay, thank you.
Thank you, Virág. So I would like to ask that what is your recommendation for the future studies?
Well, for the future studies, as I mentioned, I would study more of diseases like periodontal diseases and how chitosan is handling these kind of bacteria, or not just bacteria, these are bacteria colonies. So how chitosan is handling this. And as I mentioned, for the research of the Enterococcus fœcalis, I would mention to use a standardized study protocol.
Thank you.
Thank you. I'm sorry if I missed it. What's this inhibition rate? Because it's a rate and it's in millimeters. So
yeah, inhibition rate is like a biological
yes.
context. It's when there is a plate, you know, a culture.
So it's a zone. Maybe I would call
it's
it like a zone
yes,
of inhibition.
It's a zone. And in the culture, you know, there is the colonies of bacteria, and you use the
so it's an in vitro study
yes,
then?
Yes, yes, yes.
But it's like the overall effect like shows that sodium hypochlorite could actually be better?
Yes, I know that the overall effect shows us that, but this is what I mentioned, that I think there is not enough studies, and that the studies were not using actually the same protocols. Not all in the cases they use the same bacterial I'm sorry, I'm forgetting the words.
You see, there are hardly any studies which would actually favor chitosan to the extent that I would like go on and continue more in vitro studies, because like most of the squares say fall on the left side.
Yeah, but if you check like the ones that is close to the null effect line, they actually say that there were no quite difference between using chitosan or sodium hypochlorite. So if we check this, and if we are starting our journey with this, then we can say, okay, now we know that maybe chitosan could be as good as.
Yeah, so equivalence would be just as good.
Yes.
Okay,
so
I see.
So if it would be as good as, it would be, for clinical relevance, it would be great for us. So not just if chitosan would be better.
Were there no like differences to make like some sort of regression, like the zone of inhibition or rate of inhibition as compared to the concentration of chitosan and hypochlorite? I know it's just 6 studies, but like I've seen regression with fewer studies. So.
No, there were no regressions.
If you know the exact percentages. Okay, thank you very much.
Thank you.